Okay, we're just getting started on your right shoulder. We're looking in from the back to the front. Everything's magnified 30 or 40 times on the screen. What we're doing right now is just smoothing out this labrum. Your biceps tendon is torn, and we're going to be doing a tenodesis, but this labrum right now needs to be trimmed back just so we can even see that. So here's the biceps tendon. You can see how significantly torn it is. Okay, so that's normally a nice, smooth, kind of white rope. And you can see here, my shaver is kind of illustrating where it's torn. So the tenodesis procedure allows us to reattach this in a different part of your shoulder. We'll go ahead and take a spinal needle, start working on that. So there's the needle going right through the middle of what's left of it. We'll take a super shuttle and pass that. Hold the camera with your left hand. So that's the picture. And so now that we've got the relay, keep pushing in so you can see. You maybe rotate the eye to about 1 o'clock or 2 o'clock. Otherwise, yeah. And now we'll pull back on the relay. That's going to bring a blue and white suture that you see there back through. And now we're going to do the same thing one more time. Pause. Okay, so we're done releasing the biceps. This is inside the joint. We'll just give you a look around. There's not too much arthritis, which is good. This is the back of the shoulder. And as you come down here, there's the glenoid and the humeral head up above. Looks good. As we look down the front of the shoulder, a little bit of fraying in the anterior labrum. We'll smooth that out a little bit, but by and large, the inside of the joint looks pretty good. You've got this really big rotator cuff tear here, and we're going to get to work on that in just a minute. Okay, so we've done the tenodesis on the biceps. That's actually the cut edge of the clavicle right there. And we're just looking in the back. I think we're going to get lucky. I think this tendon was partially torn. Well, we knew it was partially torn, but I don't see where it's extending on the bursal side. You had a very big type 3 acromion, and we've taken off that bone. So you can see in the front here, this is now nice and flat. We've taken that all the way out lateral as well. But that was actually just about touching before. And I was worried that that had worn through, but it looks okay in the front. As we look at the rotator cuff in the back here and internally rotate, that looks good. As we slowly externally rotate, I can't tell you how happy that makes me that we don't have to do a big cuff repair for you. And then it was really just came down to that biceps tendon. Now there's the sutures for the biceps that we've tenodesed. You can see that right there. And as we go all the way to the front, cuff looks okay here too. So I think we're going to start to wrap this up and maybe take one more good look around, make sure there's nothing else to do. But I think this will be the bulk of the surgery that we have to do. If there's anything else significant, we'll come back up and show you. But otherwise, good luck to you now. I really hope this does the trick. You'll recover a lot quicker as a result, which is also good news. Bye-bye.